Get over yourself. Hi guys, Tin Spence here again. Yes, get over yourself. You might have gotten over all your exes in the past, but have you gotten over yourself? I think getting over yourself is one of the things that you have to be able to do, or you'll have to do over and over again throughout your lifetime in order for you to grow as a person and as a professional. I've noticed that there is a trend when you're new, you get to know things and you're trying to learn things, and then you get to a point where you're comfortable and you learn when you've learned a lot, and then you start realizing, oh, you're good at certain things. When we get to that point, sometimes gets to our head and we start developing a little bit of a superiority complex. Like, we start thinking like we're better than everybody else. So we start noticing how they do things and how you start feeling like the way you're doing it is the right way to do it. Otherwise, it's like you're doing it wrong. In the past, I have worked in a nursing home. And while I was working there, I started having that feeling, and I started to feel like I'm the only one doing things. Oh my goodness, why didn't they do this? Why are they doing it like that? My manager said to me, oh, ikaw lang ang magaling. It translates to, oh, so you're the only good one? That's in Filipino. My manager was Filipino. And I love that manager. He's one of the best managers I've ever encountered. He really cared for the patients. I really looked up to him. And when he said that, it kind of pushed me to do a bit of introspection, and that forced me to get over myself. I realized that it's true. How can I think that I'm the only one who's good? Everyone cares for the patient, but everyone has a different way of doing things. And we have to realize that. We have to always take into consideration people's individuality, no matter how it makes sense in your head that this is the best way to do it. No matter how right you think you are, that is not the case. That is not always the best thing for people to do things, because everyone will have a different set of skills. Everyone will have a different perspective. That might be the best way to do it with your set of skills, but that's not the best way to do it with other people's set of skills. We have to be careful of that. We have to take a step back and be careful of falling into that trap. Otherwise, we'll get stuck in that mindset that will prevent us from growing. In my work now, I have noticed that as a trend, because we stay in the same place, and a lot of, trainee doctors will come and then go, and come back. And you notice that once people start to get to know things, and learn stuff, and they know exactly what they're meant to do, and they know exactly what they're doing, it seems like it's a trend that people start to develop that little bit of superiority complex. And sometimes it could be a little bit of a God complex. I have observed plenty of that with the doctors. Oh, and but obviously not all doctors, not just doctors, with other people as well. Superiority complex and God complex, the difference between them is superiority complex is like having this feeling that you're better than everybody else, and God complex is like you see the people around you as not your equal. You see them as a means to an end. It's kind of like they're there to serve you. I have observed some doctors who treat the theater staff in that way. Like, we are equipment. Like, we are not people. Observed from the way you are spoken to. Like, you see that when they speak to their peers, the people with the same job, they speak a different way compared to when they speak to everybody else in the team. Sometimes they will go to the anesthetic room and be like, Why is the patient not here yet? Or why are they taking so long in the anesthetic room? As if the anesthetics don't care about the patient enough. And it seems like the way they express things is that they think that the ward is useless, the anesthetics are useless, the theater staff are useless. And it's like they're the only ones that actually care about the patient. But that is not the case. We all care about the patient. The ward cares about the patient, anesthetics. And sometimes the reason why they take a long time to get ready for the patient in the anesthetic side is because they're trying to get all the monitoring done and ready because they want it to be safe for the patient. We all care for the patient, but we have different perspectives and we have different ways of doing it. Sometimes it could just be we have different ideas of how things are meant to be done. I think we just need to be open to that. We are all doing it for the patient's best interest. When you notice yourself that you're starting to be overcritical about how other people do what they do, maybe it's time to take a step back and get over yourself. So you won't end up sliding into having a superiority complex or a God complex. I hope you like this video. Give it a thumbs up if you like it, share it with your friends, and subscribe to my channel. I'm a ninja without a name. Don't fall in love.